Hello friends, welcome back to Alpha Physio Pelvic Care, all things pelvic health. And today, very important topic. Today I will tell you 10 questions that are important to ask your healthcare provider, OBGYN or midwife in your pregnancy. This came to me through my experience and working experience, and what I have noticed that many questions that have not been asked or discussed create confusion, they create wrong expectations, they create expectations from both parties that have not been fulfilled, and so on. So these questions are really not to interrogate your healthcare provider. You really want to build a team, or maybe you want to decide that you want to look for somebody else. These questions are for you both to decide if you're on the same page and make sure this experience is maximally positive for you, independent on what your birth ends up to be, and also that your healthcare provider can help you as much as possible. So let's go. Make sure you subscribe, you like this video, if you enjoyed it, if you find it useful, share this with your pregnant friend. And please remember, you don't have to go with a list. You can ask these questions as the pregnancy progresses, or maybe on the other hand, you would like to have a written answer and to be specific. Maybe you are worried that you might forget, and you can send an email with these questions to your healthcare provider in pregnancy. Of course, this is not complete list. There are many other things that you might decide to ask. And if you think I forgot something, please feel free to pop these in comments. Maybe you asked something that was very important for you. So let me know. Now, because there are 10 of these questions, I will be checking a little bit my notes to make sure I haven't forgot anything. So number one, do you accept birthing plans? A birthing plan is a plan how would you expect your birth to be. Of course, we all know things might happen, but this is why we also have ABC and birthing plan. Are you planning for vaginal birth? Is it feasible at this moment of time? What will happen if you do need a cesarean C-section immediately? Will it be your partner who will take the baby skin to skin? Will it be general anesthetic if time and circumstances permit? Will it be epidural, and so on? So a lot of background noise here. Christmas is coming. So birthing plan, and listen what your healthcare provider tells you. Are they okay with that? Or are they like, no, it's fine, we'll see how it goes. And it's up to you to decide how you want to proceed further. I personally did discuss my birthing plan. I did not give it written, but I know people who did give it written to their doctors, and they were very accepting, and they read through it and they followed to it as much as it was medically feasible at that point of time. Number two, are you going for X type of birth? And let's clarify this one. Of course, in ideal world, we are looking into vaginal birth with no complications. But life is life. Life happens, we all have our choices, and we have right for our choices. So if you come to a doctor expecting a vaginal birth, and so far there is no contraindications to it, do ask your doctor, are we going for time being, as things stand health-wise, for vaginal birth? Or maybe you decided that vaginal birth is not an option for you. Ask your doctor, is it possible for me to have elective planned cesarean? And you don't want to have this pressure of doing otherwise if there is no any specific medical indication. You don't want to be stressed that, I didn't really get the clear answer and my due date is around Christmas time. Am I going to have a C-section? Is the doctor happy about having me vaginal birth? Or maybe it's a cesarean, or vice versa. Will the doctor sit there and try to persuade me for vaginal birth whilst I want elective cesarean section, and it will make me even more stressed out, and eventually I'm gonna get up and go. So talk about the birthing experience in a sense. What exactly do you want? And from there we can go to next question. Question number 3. Episiotomy. If you are going for vaginal delivery, is episiotomy a routine? Episiotomy is a cut to the perineum, to the vagina, that is done towards the end stage of labor when baby is crowning, is coming out from vagina. And this is where exactly my works come through, because I'm a pelvic floor physiotherapist. I rehab people after birthing injuries and including episiotomy. World Health Organization does not recommend episiotomy as a routine procedure. So episiotomy should be really, really justified by circumstances during the birth. Discuss with your doctor what these circumstances might be. Discuss if episiotomy is something routine. There are healthcare providers who do episiotomy routine. There are protocols within that certain establishment that episiotomy for the first 10 months is routine. So decide if this is something you're okay with, or this is something you want probably to change. We're moving to the point number 4. How long I can go past my due date? Very important question. Because if a healthcare provider policy or hospital's policy is 40 weeks and not a single day extra, that means you are very likely to have birth stimulation. That means statistically it increases your chance of so-called cascade of interventions, where you are given Pitocin, artificially stimulating the contractions. Your contractions might be too strong. You might ask for epidural. Therefore, it might reduce your mobility. Therefore, it can put baby in a distress. The extra contraction, heart rate might drop. You might end up with a cesarean section that you probably did not want to have. So, and the whole process might be really, really tiring for a mother and a baby. So make sure that you discuss with your doctor what is their policy on due date. Are they happy to let you go a few days? Are they happy to let you go 1 week, 2 weeks? How are they going to monitor you? Are you going to come in every day? It can be quite stressful to be monitored every day. It can put a lot of pressure on you. So these things needs to be discussed in advance. I would say in the first half of pregnancy. Please do not wait until you're 38 weeks to go and discuss these things, because in case you want to change your provider, it's going to be way harder than in early stages. And now we are going to point number 5. Ask your healthcare provider, does themselves and the policy of establishment where you're going to give birth allows birthing partner, doulas. And let's break this one a little bit apart. Birthing partner can be usually and is a husband, a partner, could be mother, sister, friend, somebody who is a related and relative to you. Doula is a professional who is getting paid, and again, she is birthing partner, but she also will witness the whole process also from a little bit professional standpoint. So if you do want to recruit a doula, make sure your doctor, your healthcare provider, the establishment where you're giving birth are accepting doulas. They're accepting doulas in all kinds of birth. Even if you end up with a C-section, are doulas allowed to theater, to comfort you, to be there with you? What about your partner? Is your partner allowed in a birthing suite, or are they only allowed to be with you in the room and they're not allowed to be in the birthing suite? So all these things needs to be discussed, because it can be a very overwhelming experience when you give birth, and you need there somebody to support you most of the time. I know women who didn't want any partners. That's absolutely fine, but in case you want, please talk about it in advance. And moving to the point number 6. Ask your healthcare provider, do they support movement and positional changes during birth, during labor, and during the actual pushing stage? Are you allowed to walk up and down the corridor? Are you allowed to move in the room? Are you allowed to change the position the way you want? Are you allowed to squat, to be on a 4-point kneeling on your side, and so on? Is this okay? And it might sound like self-explanatory. Of course, it's my right. But believe me, many women would go and expect their rights to be met, but the policy would be no, or the habit of labor and delivery in that certain establishment with those certain healthcare provider will be no, you need to be on your back, or no, you need to be in your bed, no, you're not allowed to move around, no, there are other 5 women giving birth in the next to you, so please don't make too much noise, or no, you have to have epidural in early stages so things are under the control. These things needs to be discussed in advance and see if your expectations and your wishes are going together with what is allowed by healthcare provider. And moving now to point number 7. This point is particularly for moms who do plan to have an epidural, or moms, or in general, if something might happen and you need to go in C-section, if it's feasible to have a spinal block. Let me tell you that sometimes there is not choice when it comes to emergency C-section, and sometimes women does need to go under general anesthetic. There is simply no time. But we are not talking about now their emergency. We're talking about more of a choice where time and situation permits such choice. And it would be, if you decide to have an epidural, do you need to decide way in advance so the establishment can call anesthesiologist, he can arrive, or there is somebody available in the place and you can actually see how it goes and see how long you can go without an epidural. Sometimes if you're, let's say, 4 centimeters and you feel like, I'm not sure I can take it or not, and the midwife, the doctor, the healthcare provider will say, okay, now it's the time to do epidural because we need to call the anesthesiologist, he needs to arrive. So availability of medication in general, pain relief, and epidural anesthetic. How fast? Even if you plan to do unmedicated birth, I would really suggest to talk about this as well. All right, number 8, we're getting there. Don't forget to press like if you're enjoying this video, and don't forget to share with your pregnant friends. Number 8, can I bring my own equipment? Quite a few clinics will provide you with a ball, maybe with a mat, but I know some women, they want their own type of equipment. They maybe want their scarf that they can hang on the door like rebozo and stretch on it, or they might want their own ball. They want to bring their peanut ball. They want to bring their TENS machine for pain relief. So ask your healthcare provider if you can bring the things that makes you comfortable. Of course, we are talking within reasonable limits. If you want to bring your own swimming pool within a birthing center or a hospital, that might not be realistic. Maybe you'll have to go on with the shower that is there, or maybe they have a tube available, but something that you can actually lift and carry. Please talk about if you can bring these things with you. Number 9, very, very, very important one. Guys, you cannot imagine how important until you are in labor for 17 hours. Eating and drinking policy, especially drinking policy. I have had countless mothers who have been exhausted by labor and ended up in a cesarean section, and I believe only because they've been so dehydrated and so tired they were not allowed to drink. The concern is that there will be aspiration in case woman needs an emergency C-section under general anesthetic. But I tell you that your chances of getting that C-section from dehydration and exhaustion are way more higher than the chances of aspiration. Besides, we're not talking about drinking gallons and gallons of water. It's small sips, and by the time, even if you need to go into theater, they will be already absorbed. It can be also some juice and also eating. There is no law, there is no recommendation worldwide that says no eating, no drinking during labor. It is allowed. Let's be reasonable here. We can talk about half piece of toast. We can talk about some dry fruits, especially when woman is in a labor that is not like 10 centimeter pushing stage. I don't think so anyone is very hungry at that stage. However, there are exceptions. But eating and drinking, especially drinking policy, I cannot stress it enough how important it is for you, and it literally can make a difference between you being able to walk through let's say make it through the labor and not end up in a theater with emergency C-section. And last point, we all talk about now birth, what is happening in labor. Please talk about post-delivery policy. What is post-delivery policy? If it's a vaginal birth, what is happening with placenta? Is placenta delivered? Is it pulled out? Are you getting extra shot of oxytocin? Is staff willing to wait until placenta get delivered naturally? Decide what you want to do with the placenta. Skin to skin when baby is delivered. Is baby whisked away from you, or are you allowed to place the baby skin to skin, providing there is no emergency? Skin to skin is official WHO recommendation, providing there is no threat to the life of baby and mother. What about initiating breastfeeding if you want to breastfeed, and so on? What about stitching? Will there be anesthetic into stitching? All things rooming in, all things supplementation. Does a hospital or establishment where you deliver provide any consumables such as post-birth pads? They're kind of big period pads. So all these things, please talk about them. If it's a cesarean section, again, skin to skin, is it possible? Partner presence before, after operation. Is there a help with the baby? Because it will be after major abdominal operation. What are the pain killing options? What are the pain relief options? Because as soon as anesthetic will start wearing off, you will feel it, and you will need to discuss a pain relief options with your healthcare provider so you can function. So all these things post-birth, please discuss it. And there is one bonus I usually say you can ask if you feel like it, is the C-section rate in a certain establishment with a certain doctor. I will not sugarcoat it, to be honest, because so far in many countries, including Cyprus, a cesarean section rate by doctor or by clinic is not available. Officially, it's a secret. Okay, you can talk to a doctor, approximately, you know how many C-sections he or she does. The higher the rate, the less likely you will hear the true information. It's as simple as that. Doctors with a lower C-section rate, even if it's under 30%, which is considered high by WHO, but for Cyprus, where 60% C-section rate, under 30 is still all right, is still agreeable. So yeah, probably this information you will have to look indirectly and not directly from the healthcare provider, but it's really up to you. Just to make sure you establish that rapport with the doctor, just let them know that you just want to find the best way of doing things together. You are not interrogating them. We really want to establish good relationship with our doctor, and believe me, vast majority of them, they only want the best for their patients. Okay, that was it, guys. Please let me know in the comments if I forgot something, which I'm surely I did, and I will be happy to talk about it more. The reason why I'm talking about these things, because I hear them and I work with the consequences of the things done in labor after. So this is kind of directly my job as well. I really wish you to experience the birth of your children, of your child, the best, the calmest way possible. I want it for you to be positive experience, no matter how you choose to birth or how it happened to birth your children. The most important is this humanly support and humanly understanding within that very vulnerable period of life in a woman's life. We'll see you all very, very soon. Ciao, ciao, and we talk again.